Good afternoon and welcome to today's webinar, Health Insurance Updates and Open Enrollment for 2023. This presentation is intended to give general information and is not intended as legal advice. This webinar also does not establish an attorney-client relationship. There will be time for Q&A after the presentation. I also welcome questions during the presentation if they would be beneficial for the group. One last thing, I also want to say that I hope to be able to answer your questions, but there may be instances I might have to tell you I don't know it, either because it's not information I have offhand, or it might be too specific for today. However, I encourage you to fill out an online intake with us so we can properly research the information. This is the final webinar of the Empower Hour series. These webinars are, are supported by a generous grant from the Tower Cancer Research Foundation and a generous grant from CGen. All of the previous webinars are available at the CLRC's YouTube page. The CLRC stands for the Cancer Legal Resource Center. We are a program of the Disability Rights Legal Center. The CLRC provides information and resources to people affected by cancer, including patients, survivors, caregivers, and healthcare professionals. Our resources are free, regardless of income. People often ask, what does cancer have to do with the law? This is a list of some cancer-related legal issues. Cancer affects the patient, survivor, families, healthcare professionals, and impacts many different areas of the law. If someone has a legal question and is affected by cancer, whether or not the topic is listed here, they can contact the CLRC for more information. The CLRC also has a professional panel, which includes attorneys from across the country who help those with cancer if a caller needs help with a matter in their state and practice area. You saw on the previous slide the practice areas that attorneys handle, but just to recap some of them: landlord-tenant, health insurance matters, medical malpractice, estate planning, employment law, and divorce law. It's a minimal commitment. All that the attorney agrees to do is a half-hour consultation. It's very easy to apply. If you would like to view our resources on any number of topics related to cancer, please visit our website. Educational webinars like this one are recorded, so we can later put them on our YouTube channel for you to share with anyone who may want to learn more about a variety of subjects. If you have questions about today's presentation, please type them in the chat box. I will be leaving time at the end to answer some questions. That part of the presentation will not be recorded. However, if you have questions about your specific situation or someone you know has a question you want to ask about, please fill out our online intake form at clrcintake.org. As you can see on your screen, after you do so, we can research laws and resources for you and provide you with free customized resources. Everything is confidential. With the generous support of the American Cancer Society and Breakaway from Cancer, the CLRC has a revised version of the Patient Legal Handbook. This handbook provides an introduction to the most common legal issues that a patient diagnosed with cancer is likely to face. It is available to download for free online in English or Spanish by going to our website, www.theclrc.org. Providers can request printed copies shipped to their offices for free. This webinar will give an overview of insurance basics, current insurance options, consumer protections, and ways to maintain or change coverage, whether you are shopping on or off the health insurance marketplace. I want to quickly go through some of these insurance basics with you. That way, if you're looking to purchase new insurance, you're familiar with the terms you'll be seeing. I know some of this is going to be straightforward and that a lot of you are quite knowledgeable when it comes to your health insurance. However, I just want to make sure everyone is on the same page. The first thing to remember is that it is the patient's responsibility to understand their coverage and limitations. Saying, I didn't know that wasn't covered, doesn't work as a way to get out of a medical bill. Even when we call our insurance company, there's a recording that says verification of benefits is not a guarantee of coverage or something to that effect. We can't even always rely on the physicians treating us to know what's covered by our insurance plans and what isn't, or to what extent. Even if your provider's office says they will call the insurance company to find out or tell you something is covered, it's always a good idea to become familiar with your plan so you understand copays, deductibles, and networks. This helps prevent unforeseen costs. So, in part one, we're going to go over some of the basic information everyone should know and understand about insurance. Knowing your insurance company, for example, knowing that it's Blue Shield is not enough. If you call a doctor's office to make an initial appointment, they'll ask whether it's private insurance. This is because Blue Shield is also a Medicare and Medicaid provider in some states. Not all doctors accept all insurance plans. Private insurance is one you buy as an individual or family or get through your employer. Medicaid is insurance for people who are low income and meet other requirements. If you receive supplemental security income known as SSI, you should be eligible for Medicaid. Medicare is insurance for people who have been receiving Social Security disability income or SSDI for 2 years or are 65 years old or older. Private insurance, as well as Medicare Advantage or Medicaid plans, can all be managed care plans, such as HMOs, PPOs, and POS claims plans. HMO stands for Health Maintenance Organizations. HMOs usually have a limited choice for their members because members have to select doctors and hospitals from within a participating medical group. This is why they are typically less expensive than a PPO. The other types of private insurance are PPO, stands for Preferred Provider Organization. Here, the network of providers is less limited than HMOs, and physicians are reimbursed at higher rates for services provided. However, PPOs are usually more expensive than HMOs. POS stands for Point of Service. These plans combine aspects of HMO and PPO plans where you have to get a primary care physician to make specialist referrals like an HMO. Users usually have some freedom of choice in providers, even those providers who are out of network, such as with a PPO, but with greater out of pocket costs. EPO stands for Exclusive Provider Organization Plan. As a member of an EPO, you can use the doctors and hospitals within the EPO network, but cannot go outside the network for care. There are no out of network benefits. Here are some other basic terms to understand. Copay is the fixed amount you pay for a covered health care service. This is usually paid when you get the service. Most office visits or specialist visits have a fixed copay amount that you will either pay in office or be billed for later. It's a good idea to become familiar with your copays for different services. For example, your insurance policy might charge you $20 for office visits and $40 for specialists. Deductible is the amount you have to pay each year before your health insurance plan begins to pay. For example, if your deductible is $1,000, your plan won't pay anything until you paid $1,000 for covered services. So your first visit or visits up to $1,000 may all be out of pocket. Coinsurance is usually the amount people are often most surprised about. Most insurance, even the best insurance, doesn't cover 100% of the cost of a visit. People will usually have a coinsurance, which is your share of the cost of a covered healthcare service. It is usually calculated as a percentage. If you paid your copay, you are billed a random amount like $8.93 for a physical therapy visit that costs $89.30. That's probably a 10% coinsurance. So once you meet your deductible, you might have coinsurance on top of your copay. Also, it's very important to know whether or not certain procedures or services require pre-authorization. You may have to get your doctor to submit a prior authorization to your insurance company in order for a service to be paid. It is also important to understand your limits. I'll use physical therapy as an example. Some plans limit you to 20 physical therapy visits per year, while other plans allow you an unlimited number of visits, but you have to see your doctor every month for a prescription. So understand your plan's rules about services that you need. Okay, we have to understand our coverage and read our policies, but where do we find this information? Your evidence of coverage or summary plan description can usually be found on your plan's website. If you have coverage through an employer, you can contact your human resources department to get a copy of the contract if you don't have it. The terms of the policy is the first place to look in determining what is covered. There are many federal and state health insurance regulations regarding services that health plans must provide that would supersede those provided for in an insurance contract. That means there are protections that exist as your rights, whether laid out in the plan or not. An example is coverage of pre-existing conditions and annual screenings without needing to pay a copay or deductible. Often, all of this information is available online through your health insurance company's website. You can also call your insurance company to request a hard copy of your plan documents. If possible, it is best to access this information prior to a time when you are in need of urgent care so that you can at least know where and how to access it should an urgent medical question arise. Just like with your overall insurance plan, it is a good idea to become familiar with your prescription drug benefits. Medications must first be approved by the Food and Drug Administration, or FDA. Until a drug is approved, it cannot legally be given to anyone, except through an approved clinical trial or in a manufacturer's compassionate use program approved by the FDA. Each plan has a formulary or list of approved medications. Formulary medications can usually be prescribed without pre-authorization. Drugs on a formulary are typically grouped into tiers. The tier that your medication is in determines your portion of the drug cost. A typical drug benefit includes 3 or 4 tiers. Tier 1 usually includes generic medications. Tier 2 usually includes preferred brand name medications. Tier 3 usually includes non-preferred brand name medications. Tier 4 usually includes specialty and biosimilar medications. Three-tier programs do not have a unique tier for specialty medications. The insurance company, not your physician, decides what is on their formulary. If your provider prescribes a non formulary medication, check to see if there is a formulary equivalent. If not, talk with your healthcare provider about requesting special formulary coverage from your insurance company. Some insurance companies require step therapy. This is the practice of beginning drug therapy for a medical condition with the most cost effective and safest drug and progressing to other, more costly or risky therapy only if it is necessary. It is important to work with your doctor on appeals to discuss why the prescribed medication provides the patient or provides you with the best possible outcome. Compassionate use programs allow a manufacturer to give certain individuals a medication that is being tested in clinical trials before the FDA has made a decision about approving or not approving the drug. When the FDA approves a drug, it is approved for certain conditions or indications as you often see on the label. Regardless of what the label says, a physician can legally prescribe an FDA approved drug for any reason. This is called prescribing the drug off label. Note that your insurance company may not approve the coverage. Finally, if an insurance company is repeatedly issuing outrageous refusals to provide medication, some desperate patients have taken to social media, including Twitter and Facebook, and enlisted their friends to publicly demand coverage, often with effective results. Someone with cancer can check their insurance companies to see if they offer a case manager. Case managers can be your go-to person for information about your plan, and often they will even go through appeals or advocate on your behalf to gain coverage or reduce costs. If your plan does not offer case managers or patient navigators, ask to speak with the same person each time you call a certain department if possible. Now, that's only if you have a good rapport with them. If you do not have a good rapport with them, do not ask to speak with the same person, but you might want to write down their name so that you can also request not to speak with them, or if you receive them on the other end of the line, you could ask to be transferred to someone else. If you do like the person you're speaking with, write down their last name or employee number and extension. It is helpful to keep one contact for each department and make friends with them, because some positive rapport can go a long way towards saving a lot of money if they spend time finding ways to reduce your costs. You can also avoid having to re-explain your entire story each time you call. Keeping track of who your contact is will assist with keeping accurate records, including careful notes of each phone call, date and time, names of contacts, information covered, authorization numbers, any written communications, copies of bill, explanation of benefits, check stubs, etc. These are all very helpful for appeals. Maintaining an accurate journal or a binder of notes will lend credibility to you if there is a discrepancy. While this is a lot of work, filing systems are helpful to assist with keeping track, and it may be helpful to use a notebook to contain information. Pre-authorization or prior authorization is a decision by your health insurer that a healthcare service or prescription drug is medically necessary. Pre-authorization doesn't always mean it will be authorized. If you have to get a prior authorization, ask them to send you a written copy of the prior authorization. This should go without saying, but open all your medical mail, even if it seems daunting. If you are opening your mail, you have taken the first step to understanding what you are up against. Sometimes there is no way to appeal decisions if you have waited too long. Thus, it is important to check for mistakes early. Review all bills. Mistakes happen. A simple phone call sometimes helps. Review each charge. We have a handout on our website with some helpful information about medical billing. You have to play an active role in your healthcare delivery, including the billing and payment. It is important not to be unaware of what your coverage is. If you read something that you don't understand, call customer service. Take notes. Beyond just knowing what kind of plan you have and how much your deductible is, you might need to know what percentage of certain services are covered and who is in your network, and whether they reimburse for out-of-network coverage. If you don't have the energy to do this, see if a friend or family member that you trust would be willing to do this for you. Now that you know what kind of insurance you have and some of the basics about insurance generally and how to maximize that coverage, let's talk a little bit about some of the rules about coverage, as well as some of the options you have if you need to purchase new coverage. I want to clarify a few terms that refer to different types of private insurance. Group: purchased by an employer and offered to eligible employees of the company and their eligible dependents. The employer selects the plan or plans to offer to employees. The premium cost is normally split between the employer and employee, and there is a minimum percentage rate the employer must contribute. Individual: you purchase individually for yourself and or your family on your own or through the insurance marketplace created by the Affordable Care Act. The Affordable Care Act is also known as Obamacare. These are often purchased with the guidance of an insurance agent to help navigate plan choices and premium costs. Insured is the more traditional way of providing employees with health coverage, where employees buy a health plan from a company and the employer either pays a portion or the whole premium. This is a fully insured plan. Self-insured means an employer just opts to pay the employee's medical bills directly. This is more common in larger companies, and often people don't know their plan is self-insured because an employer may use an insurance company like Blue Shield as a third-party administrator. Grandfathered plans, created and purchased before the Affordable Care Act on March 23, 2010. Don't have to follow the new rules. Check the date of when your plan was created. Some self-insured plans don't have to follow the Affordable Care Act because they were created before the Affordable Care Act was implemented. These are called grandfathered plans. Under the Affordable Care Act, which passed in March of 2010 and was fully implemented in 2014, a lot of changes took place. One of the most important is insurance plans that count as minimum essential coverage can no longer discriminate against anyone with a pre-existing condition or genetic predisposition like cancer. The pre-existing condition rule is true for health insurance, not to life insurance, disability insurance, or long-term care insurance. Some states offer protections for people with pre-existing conditions who want to obtain those types of insurance, but this topic is out of the scope for this presentation. For health insurance, you cannot be discriminated against because of a pre-existing condition. So for anyone with cancer or a positive genetic test for a predisposition to cancer, you can still buy COBRA, marketplace insurance, and get Medicaid, regardless of your health history. Your age and where you live are the only personal characteristics that can be used to set rates. This change is significant because before 2014, gender was a determining factor in establishing premium rates, and women were typically being charged a higher rate than men. Now, gender cannot be a determining factor in setting premium rates. Reading area is an area used for determining premium rates, usually by zip code. The premium is based on the average healthcare costs and physician hospital discounts in that area. So costs may be higher if you live in a metropolitan city versus a small town. In late December 2017, Congress successfully passed the Tax Cuts and Jobs Act, repealing the penalty for the individual mandate. This is a slide that talks about the updates on the Affordable Care Act. The repeal of the penalty went into effect in 2019, but the person is still required mandate to have insurance because the mandate itself was not repealed, but someone does not have to pay a fee if they do not comply. The slide summarizes because there is some confusion sometimes about the Affordable Care Act, but I'll just get to the bottom line. And if someone has questions at the end of this presentation, I'd be happy to go through it. The most recent activity is that the U.S. Supreme Court threw out the latest challenge to the Affordable Care Act. So the Affordable Care Act is in place, and that's ultimately probably the key takeaway. And the CLRC is paying close attention always to what's happening in terms of the Affordable Care Act. So feel free to check with us if you have questions about any potential changes to the law in the future, if that were to be the case. And ultimately, the Affordable Care Act is in place. There have been challenges, but as I mentioned, the U.S. Supreme Court threw out the latest challenge to the Affordable Care Act. If you're looking to purchase insurance through your state's marketplace or healthcare.gov, we are getting to a critically important time of the year. It's important to keep in mind that you can only purchase or change plans during open enrollment or if you are eligible for a special enrollment period. For healthcare.gov, open enrollment is from November 1st to January 15th. Some states have their own private online marketplace while others use healthcare.gov. When you enter your information on healthcare.gov, if your state has its own marketplace, you'll be directed to that marketplace website. Something that's important to highlight is that open enrollment time is limited to 6 weeks. And unfortunately, this can reduce enrollment. States that run their own health insurance marketplaces can and do have the option to extend this period. This is a national webinar, so we are sharing this information with everyone across the country. So I thought it would be a good idea to just include some highlights of certain states such that extend enrollment deadlines, and ultimately it is important to consider the fact that to ensure coverage by January 1st, it's a good idea to apply by December 15th, regardless of your state's enrollment period. So if there's one thing that you take away from that slide, I would say that try to aim to apply by December 15th. It's a good idea to check with your state's marketplace as soon as possible to confirm your state's deadline for applying for coverage. So that's a tip as well. Now let's talk a little bit more about open enrollment. And that's why the CLRC, we do this webinar every year because it is so important. Even if you think you're happy with your insurance, it might be a good idea to just check out other options and see if there's a plan that suits you better. Plans in the health insurance marketplace are organized by metal categories: bronze, silver, gold, and platinum. The categories are based on how you and your plan split the cost of your health care. the quality of care is the same. For bronze plans, the insurance company pays 60% of costs and you pay 40%. For platinum plans, the insurance company pays 90% of the cost and you pay 10%. It may be tempting to buy the cheapest plan, the one with the lowest monthly cost, but some of those plans with lower premiums may end up costing you more in the long run. That's if they have higher deductibles or higher out of pocket costs. When you enter in your income on the website, you'll learn whether there are tax credits to help you lower the cost of your insurance premiums each month. If the cost of the benchmark plan, which is the second lowest cost silver plan available, is greater than 8.5% of someone's annual income, the person will be eligible for a tax credit for the difference. This credit can be used to buy a more expensive or less expensive plan than the benchmark plan. If a person's income is below 400% of the federal poverty level, the threshold for a tax credit will be less than 8.5%. However, there are many gaps that exist for making plans actually affordable for people, whether they receive tax credits or not. If you reside in a state with expanded Medicaid, you must earn at least 138% of the federal poverty level to qualify for tax credits. If you reside in a state without expanded Medicaid, you must earn at least 100% of the federal poverty level to qualify for tax credits. So, in addition to price, when you're shopping for plans, compare all the different insurance company plans. Depending on where you live, there may be many options or only a few in each category. If you like your doctors and providers, first check with those providers to see which market plans they accept. You might want to choose your plan based on doctors as a network. An example is when um, our office had a certain plan, and then we had a slightly different network of doctors than we did after we changed plans. So, especially if someone is affected by cancer and has medication and or providers, medical providers that they think are especially helpful, it's a good idea to first check with those doctors and check if the medication is covered before deciding to ultimately switch a plan. Tax credits are now available for people under 65 who purchase coverage on their own in a health insurance exchange and are not covered through their employer, Medicare, or Medicaid. Premium tax credits will be available to help people pay for health insurance that will cap premiums on a sliding scale from 0 to 8.5% of income. Tax credits are used when you enroll and are paid directly to the cost of your health plan to try to keep the cost down. You do not need to wait until you file a tax return at the end of the year. Tax credits are only available through the exchanges. You must enroll in a health plan through your state's health care exchange or healthcare.gov if you want to use your tax credits. At the end of the year, the tax credits may be adjusted if your actual income is different than you anticipate. That means you'll want to notify your state's healthcare exchange or healthcare.gov if your income changes. It's always a good idea to look at your options off the exchange. If you aren't eligible for financial assistance, for example, if you're on Medicare, if you earn more than 400% of the federal poverty line, some plans might be less expensive. You can always go directly to the health insurance website or call a broker. The same plans might be available off the exchange and may be even less expensive. Now, I think it's a point to say that if a household member is eligible for affordable employer-based coverage, that household is barred from premium tax credits for the health insurance marketplace. And something new, we always try to, at the CLRC, we always try to keep the presentations both with really fundamental information that's very helpful, but also incorporate as there are updates to laws. We saw this firsthand with the pandemic, that there were additional laws that were on the books to help people, but those laws were not in place forever. They are sometimes in place to a certain period of time and then they go away. So it's always important to check out these webinars and to understand that some things are as of today's date of this recording, but of course things might change. So it's always a good idea to check back. So before 2021, if someone earned more than 400% of the federal poverty limit, they could not get a tax credit for the health insurance marketplace, but the American Rescue Plan eliminated this limitation for 2021 and 2022. But the Inflation Reduction Act extended this through 2025. So now there's no earning limit. You won't pay more than 8.5% of your income for a premium for a health insurance plan on the marketplace, but it is currently expected to continue only until 2025. If you're curious what the process looks like to shop for an insurance policy, let's use Covered California as an example. Again, this is a national webinar, so different states will have different options, but as you can see on your screen, this is an example for California. These are questions they ask to determine your rates. The most challenging part of this can be entering your household income, because you're supposed to anticipate what your income will be next year. And as many people know, that can change in even a big way throughout the year. This can be tough if you're contemplating leaving your job or if you're in and out of the workforce. But ultimately, it's a good idea to just try your best and try to see. So there are also ways to search for doctors and facilities. However, although these systems have improved since year one, I strongly encourage you to call a doctor or hospital directly to confirm whether they accept marketplace insurance plans. Many facilities have decided not to accept marketplace plans due to the lower reimbursement rates. So don't just assume that because your doctor accepts an employer sponsored Blue Shield or Kaiser plan, that they will also accept Blue Shield through Covered California. Make sure you ask. And when I say Covered California, I mean any state plan that you have. It is a really good idea to just double check. It's it's a straightforward question that can really help clarify for you if indeed you will receive the coverage that you'd like. This is especially true if you have surgeries or other follow-up appointments scheduled. The most important thing for you may be to stay with a specific doctor. In that case, I would ask the doctor or facility first which plans they accept, and then use that information to search for those plans either on or off the marketplace. Here are a few examples of some plans that were available in the Los Angeles area. I know it's very small, but you can compare the prices of these bronze plans. There are generally more HMOs and EPOs in the marketplaces. This year, for anyone with a complex chronic health condition, a PPO is probably going to provide more flexibility and will likely have a broader network of doctors, even if the premiums are higher. And I think that's an important point, because you might speak with someone who has a very different health situation than you do, and they may be going for a different plan. But if someone is affected by cancer and they want to have a certain doctor or have certain coverage, then it is crucial that they get the right health insurance for them that could actually be more affordable in the long run. Here's an example of a Silver Blue Shield plan. And as you can see on your screen, that was available in the Los Angeles area. You'll initially see the monthly premium, deductible, primary care visits, etc. If you're on the actual webpage, you can click on compare or summary of benefits and coverage. That way you'll get to see a lot more information about the plan. You may be particularly interested to learn about the prescription drug benefits. Thus, it's important to check the formulary of the plans you're looking at to see if there's specific prescriptions that you need. I want to flag if you're eligible for Medicare or Medicaid, you will not be eligible to get tax credits or other cost savings if you purchase insurance through the insurance marketplace. So just to clarify some vocabulary, Medicare is for those 65 years of age or older, and enrollment begins within 3 months of your 65th birthday, or for those under 65 who have been receiving SSDI for 24 months, or people that have end-stage renal disease. You can still become eligible for Medicare at age 65, even if you have to wait until 66 or 67 to collect your Social Security retirement benefits. You do have to have worked long enough to have enough work credits to be eligible for free Part A Medicare. However, Medicare eligibility is not specifically tied to whether or not you were currently receiving retirement benefits. Traditional Medicaid is generally for those who meet categorical requirements, are aged, blind, or disabled according to Social Security, and have limited resources, taking into account the things you own, cash on hand, but excluding the home you live in and the car that you use. Medicare's open enrollment period begins on October 15th. That's just in 2 days, and we try to time these webinars to give you the most amount of time before the open enrollment, but just close enough that it is relevant and might be on your mind. So you will be able to go to medicare.gov to make changes to various aspects of your coverage. You will be able to switch between original Medicare and Medicare Advantage depending on what works best for you. Even if you're satisfied with your plan, it is a good idea to look at what options are out there. Also, plans change from year to year, and so can your healthcare needs. And you might notice throughout this presentation, even though it is certainly through the Cancer Legal Resource Center, so much of this information is helpful really for anyone. And uh, I try to tailor the information so that if someone is affected by cancer, that it'll especially be seen through that lens. But really, anyone that is interested in learning more about health insurance, this information would apply the same way. So it's crucial to become familiar with this information, even if someone is currently in remission and not affected by cancer currently in the same way as before. It is really important to just be aware of these details, because they can be helpful no matter what. Medicare enrollment periods, the initial one is from 3 months before your 65th birthday till 3 months afterwards. Open enrollment once a year, currently between October 15th and December 7th. And then there's also a special enrollment period. So if you have health care coverage through you or your spouse's job after turning 65 and a company with 20 or more employees, one is eligible for enrollment until a specified period after coverage ends. So how much does Medicare cost? So these numbers, on your screen, it takes some time before the numbers update, but your tax returns are used to calculate Medicare costs. It's based on your modified adjusted gross income, MAGI. Part A is free for many people. In other words, they have no premium. A person would only have to purchase Part A coverage if they are over 65 but have never paid into Social Security. This generally only applies to people who have no Social Security work history or insufficient work history, such as a stay-at-home parent. For people who pay a Part A premium, the 2021 Part A monthly premium is $499 a month if you have paid Medicare taxes for less than 30 quarters, or $274 if you paid Medicare taxes for 30 to 39 quarters. The Part A Medicare inpatient deductible is $1,556 in 2022. The average 2022 Part B premium is $170.10 per month, or higher depending on income. There's also an annual deductible of $233 per year in 2022, which may apply to certain services. People with high incomes, which is considered as $91,000 individually or $182,000 for married couples, have a higher Part B premium, which people with limited incomes may be eligible for a Medicare savings program to help with paying their Part B premium. In a Part C plan, you generally must pay the Medicare Part B premium. Some Medicare Advantage plans may also charge you an additional premium. On average, Medicare Advantage premiums will decline while plan choices and new benefits increase. On average, Medicare Advantage premiums in 2022 are $19. Costs vary by plan, but the average monthly premium for Medicare Part D is $33.06 in 2021. People with high incomes have a higher Part D premium. The deductible varies by plan as well. For Part D, Medicare offered different levels of low income subsidies called extra help, which could be applied for by submitting an application to Social Security. These pay the cost of prescription drugs above and beyond a standard Part D prescription drug plan. To qualify, you need to receive Medicare and have low income and assets. For 2021, for example, for extra help, a single person had to have $19,320 or less of annual income. Here are some resources. We highly recommend the Medicare Right Center and your state health insurance assistance program. For additional Medicare resources, you can contact our office through the online intake as well. Also, check the requirements and eligibility if your state has a health insurance premium payment program. We are the Cancer Legal Resource Center, so we always make sure to provide resources. And I'll just pause for a moment for you to take this down. But the great thing is that this presentation will be available on the CLRC's YouTube page. And the point is that if there is a certain part of the presentation that you want to pause, you can just press pause on that. So you don't have to worry about taking all the details now, and certainly you don't have to worry about taking notes, because that information will be available on the YouTube page from the CLRC. While our healthcare system was greatly reformed through the Affordable Care Act, that was a great start, but we still have a long way to go. There are still many people who fall through the cracks who cannot afford coverage. Many people with an undocumented immigration status or those who live in states that haven't expanded Medicaid need to find other ways to get medical treatment. If you can't get health care during any of the ways we've talked about, here are some options. So, Hill-Burton is a congressional law which gave hospitals and other health facilities money for construction and modernization. In return, the facilities that receive these funds agree to provide a reasonable volume of service to someone unable to pay. While the program stopped providing funds in the late 1990s, certain healthcare facilities are still obligated to provide free or reduced cost care. You can call the national hotline to get a list of obligated facilities. There's a separate contact number for Maryland residents, and I listed both of those phone numbers on your screen. Charity care. Many hospitals have free or low cost care available to low income patients. Speak with a social worker or the patient services department at your local hospital to determine which options may be available. Hospitals cannot charge uninsured individuals who qualify for financial assistance more than what they charge insured patients. The limitation on gross charges applies to all hospital care, not just emergency care. Private health insurance. Although this can be an expensive option, anyone can purchase private health coverage as long as they do so directly from an insurance company or through an insurance broker. Part 3, and this is the final part of the presentation, so you can feel really good that at all what we've learned so far and that we're in the home stretch. So thanks so much for all of your participation and listening so far. And here is the final part of our presentation. Sometimes a phone call can result in a lot of savings, and other times a formal appeal needs to be made, but it starts with knowing your plan. You don't know what is supposed to be covered and what isn't, and whether you can appeal if you don't know what is covered. So just to recap, now that you know what kind of insurance you have and some of the basics about insurance generally and how to maximize that coverage, I want to talk a little bit about some of the rules about coverage, as well as some of the options you have if you need to purchase new coverage. We've briefly covered marketplace insurance, Medicaid, and Medicare, and I'm going to briefly discuss COBRA and state COBRA. So look at all that we've covered so far, and we still have some more to go, but you can see how much we've already accomplished so far this hour. If you are employed or were recently employed, COBRA, the Consolidated Omnibus Reconciliation Act, and that's why they call it COBRA, you don't want to have to say that entire name each time, allows you to continue on your employer insurance for a period of time even after you are no longer an employee. COBRA is a federal law that provides for continuation of coverage. Under COBRA, a former employee keeps the same insurance if they lose their job or drop below the number of hours required to get insurance through their job, or if they lose coverage their spouse was providing by divorce, legal separation, or death, or they become entitled to Medicare. It's expensive, but it may be the best option for people currently going through treatment. A patient can continue the same insurance coverage from their employer without having to switch doctors. So if someone feels strongly that they need to see their specific doctor for as long as possible, even if the cost is higher, this could be a good option. And you might be looking at this and saying, wow, it's going to be more expensive because the purchaser will pay the full premium, the portion that they were paying as an employee, plus the portion that their employer was paying, and an administrative fee totaling 102% of the monthly premium cost. So is it really worth it? And if someone really likes their health insurance coverage and they really need that health insurance coverage, then it might be worth it if someone's affected by cancer and they want to have that specific oncologist that's covered, their medications covered, and overall it is very supportive care through their insurance. Then it might be a calculation that they're willing to make to pay for COBRA. Most people know about COBRA, but many people don't know that some states have laws similar to COBRA that apply to employers with fewer than 20 employees or that extend the time period that a person may be eligible for continued coverage. So just to explain, states, we're talking a lot today about the national law, federal law that applies across the board throughout all 50 states, but states can do more, or they can do the same as the government. They can't do less. So it's a baseline, but certain states might be able to do more. And when I say may be able to do more, they might, for example, with COBRA, require fewer employees at a job in order to get that coverage, or have it extend to a longer period of time than the national information. So, for example, in California, CalCOBRA applies to employers with 2 to 19 employees and lasts up to 18 months. Or for those working for an employer of 20 or more employees, this law may extend regular COBRA coverage another 18 months, equaling up to 36 months of coverage. There is a downside to CalCOBRA in that it's more expensive, and during the time you're on CalCOBRA, you could be responsible for up to 110% of premiums. If you're under 65, you may notice that there are certain gaps in the insurance system. The first is that a person who is only eligible for Medicare if they are under 65 and have been receiving SSDI for 2 years. Therefore, a person under 65 who becomes disabled has a minimum period of 2 years before they can access Medicare. After receiving SSDI, a person who was previously eligible for Medicaid due to low income may lose it due to the income they're receiving from SSDI. This creates a problem of figuring out how to get insurance while you wait for Medicare to kick in. Options include COBRA or purchasing insurance through the health insurance exchange. Some states provide assistance to making COBRA payments through programs such as health insurance premium payment programs, known as HIP. In addition to these gaps while awaiting Medicare to kick in, plans that might be required through insurance companies to supplement Medicare, such as Medicare plans or Medicare Advantage plans, are currently allowed to hike up prices to people that are under 65 because they believe that the cost for a person who is disabled may exceed the cost for an average person reaching age 65. Now, as I said before, we are the Cancer Legal Resource Center, so of course we want to provide some resources for you today. And although this presentation will be available on YouTube and you can pause the screen and take down all the information, I recognize that until that happens, or if you're unable to get access to the YouTube site for some reason, I'll give you the opportunity today to just jot down some basic information if you'd like to, just so we don't lose the opportunity for you to share that information with someone else, or to utilize that information for yourself if you think it might be helpful. And as it's a great summary because we're listing the CLRC intake link, we're listing the fact sheets that we have on our website, which are very helpful. Patient Advocate Foundation, Medicare, and Medicaid. We have really helpful resources on our website, including a step-by-step guide to insurance appeals, a handout with information about accessing prescription drugs, and here are some other related areas for accessing insurance-related resources. We have now reached the end of the presentation on health insurance options. Thank you so much for your attention. If you've been with us through the entire Empower Hour series, we are so excited that you've been joining us. And if you have not checked out the other Empower Hour series webinars, or if you've checked out some but not all of them, we hope you really take the opportunity to check them out. They're still extremely relevant, very helpful, and can really be empowering, hence the title of the series. Thank you so much for your attention. If you have general questions about today's presentation or need some clarification, I will take time for questions. I won't log off just yet, but I'll end the recording now to answer questions if there are any. Thank you so much for participating in this presentation. I know your time is very valuable, so thank you so much for spending it with us. And my goal is always, we do these presentations hour length, but my goal is always to wrap up before the hour to leave time so that even if you hang on for some questions, that it will never go beyond that hour. You'll have that time. And if you are staying with us for the presentation, you'll have a few minutes to yourself at the end of the hour. So thank you so much for participating and listening to the health insurance updates and open enrollment for 2023. I will now stop the recording.